Hello friends, hope you're all okay. You're all enjoying your life, and I'm Dr. Arshad Nadeem Awan with radiology and ultrasound teaching videos. Today I'm going to discuss about the Frienburg infarction. What Frienburg infarction is, this problem is related to the foot, and this is related to the foot pain. These days quite common. I think I would say if it 20% or even more than 20% clinical complaint is regarding the foot in elder patients, those who are athletes, those who are gymnasts, those who are doing some sports activity. So the patients will come to the physician with a complaint of that he or she has a pain in his or her foot, and so the GP first of all trying to rule out what it is, and then they refer it to the physiotherapist with the diagnosis of provisional diagnosis of that there is a degenerative changes, or there might be a stress fracture, but they can't really understand what it is. And so far the scan is concerned, it becomes still unremarkable. So far the X-ray is concerned, many a time they miss the points and it comes up that there is no abnormality. So Frienburg infarction is a quite common abnormality, so I'm gonna discuss about that. Actually, what happens with the Frienburg infarction is it's a subchondral osteonecrosis of the metatarsal head. Second metatarsal is commonly involved, and the third metatarsal is 70% second metatarsal head is involved, and 30% third metatarsal head is involved. It is insufficiency fractures. What happens first? Insufficiency fractures happens, and then after that fracture there is osteonecrosis take place. As a result, the second metatarsal and the third metatarsal heads gets sclerotic, becomes irregular, slightly becomes fuzzy, and you can pick these findings on the X-ray. So this is quite interesting, and from the point of view of the physiotherapist, from the point of view of the clinician, this is an important point which usually mistaken for degenerative diseases. Actually this is osteonecrosis. On the X-rays, what will happen? So on the X-rays you will be able to see that the metatarsal heads becomes irregular, there will be a osteopenic, and beside this there will be sclerosis. So sclerotic metatarsal head associated with the soft tissue inflammation. So this would be a Frienburg disease. With the advice of X-ray, AP, and lateral view, the physician can get the help from the radiologist with the exact finding, and physiotherapist will also get all these information, whether this is insufficiency fracture, whether this is any osteonecrosis, or whether this is degenerative joint diseases. So from all these aspects you can differentiate on simple X-rays. So how it will appear on the X-ray imaging and how we will write the report, let's start watching these images. This is the radiograph and MR images of the Frienburg disease. Here you can appreciate the second metatarsal head and the third metatarsal head with a mortal sclerosis, and with the lucency in the metatarsal head, and concavity of the metatarsal head can also be seen. So on both the MR and the simple radiograph you can appreciate there is a changing of the second metatarsal head and the third metatarsal head. In these both foot images clearly you can appreciate that the second and the third and even the fourth metatarsal as well can be seen with the changes of mortal sclerosis, and with the lucency in the metatarsal's head, and also concavity of the metatarsal head. Particularly look for the second one, and you can appreciate the second metatarsal shows concavity. Another radiograph of the left foot, and you can pick the same findings in the second head of the metatarsal and in the third head of the metatarsal. These both metatarsal heads appears as mortal sclerotic and showing some lucency and concavity as well, and this is because of the osteonecrosis of the metatarsal's head, especially it's because of the insufficiency fracture. Close view for the second and the third metatarsal head. Concavity can be seen in the second metatarsal head. However, the third metatarsal shows mottled appearance. It shows sclerosis. It shows slightly lucency. Concavity can be seen in the second metatarsal head. So this is the disease which is called as Frienburg's infarction due to osteonecrosis.